he cited the sporadic violence as one of the areas of concern. He's saying we are building and not shutting down. He said the sporadic, increasingly violent protest has got to stop, and arrests must be effected on all those who vandalize and destroy property. Well, now we are joined by the convener of the Progressive Health Forum, Dr. Aslam Dasoo, Ezinja Director Professor Francois Vice Chancellor of the South African Medical Association, Dr. Mvuyisi Mzukwa, and Editor-in-Chief at the Bhekisisa Center for Health Journalism, Malan, talking to us on the President's address tonight. Good evening to you all, and thank you very much for your time. Francois, let me start with you. What is the measure of a successful public health intervention?
I think it's the number of people you can get to as speedily as possible. At the moment, our vaccine program is showing welcome signs of acceleration. Unfortunately, we're not seeing it hitting the groups that we need it to. We need it to be hitting predominantly over 60s, the people with comorbidities. And part of the acceleration has come down, and I want to just acknowledge there are heroes on the ground in terms of doing this, that we are not getting. A lot of the people we are getting onto the program at the moment are below the age of 60, people without significant comorbidities. So while the absolute numbers look heartening, we do need to be asking some hard questions about who is getting vaccinated.
Yeah. It seems we are taking a broad stroke, right? A broad lockdown, as opposed to looking at or shifting our focus to localized outbreak and determining who's infected and who's most at risk. I mean, what is preventing us from taking that route?
So I think that there is something to be said for localized lockdowns. South Africa, as opposed to much of the rest of Africa, has good surveillance of where the early infections are and is in a position to intervene earlier. But Gauteng, we started 2 weeks ago when these kind of measures are probably way, way, way too late. It may even have been too late then for places like the Western Cape and some of the other provinces that are being hammered at the moment. I just think that at the moment, Gauteng's in a position where the health services are so stretched that every single ounce of political and operational and Department of Health energy needs to be focused on preserving the healthcare systems. In some ways, debates around aspects of lockdown are a distraction from where the support is actually required. The vaccination program, though, needs to keep going. I was alarmed to see that some of the sites in Johannesburg were shut down because of the protests today. We need to get everyone vaccinated as quickly as humanly possible in tandem with protecting the healthcare services so that the fourth wave isn't going to decimate us like it is at the moment.
Mia, let's look at the numbers then. What are they telling us as far as Gauteng is concerned at this point?
In terms of vaccinations for South Africa and Gauteng, of course, as well, we do have supply that is increased for the next 18 days. On Thursday, we had 18 days of supply left, and we also have another 3.6 million doses of Pfizer coming in between now and the 2nd of August. I was quite glad to hear that Aspen is going to start to provide J&J doses because we are behind with our J&J delivery schedule. We should have had 3 million doses by now, according to the health department's delivery schedule, and we've only received 1.5 million. So it's quite important that we get dates of delivery, and of those 17 million from Aspen that we heard about in the speech, it's important to know how many of those will South Africa get and when.
Yeah. Is it any clearer for you when they'll actually start rolling out? Did the President mention the 1st of next month?
So the challenge, well, the 1st of next month is for weekend vaccinations. The challenge with J&J that we have at the moment is that they all expire in early August. So that's why we're only using them for essential work groups at the moment so that we can use them up very quickly. But we do need to start urgently roll out those vaccines at sites, and especially in rural areas. And we cannot have a date of when we're going to start to roll them out until J&J hasn't given us delivery dates, and we don't have those dates yet. They did tell the health department that early this week there will be delivery dates that are sorted.
Now, hospital admissions, the President saying, looking at the whole entire country, all the hospitals in the country, it looks like there is beginning to be some pressure in that system. In fact, even more than what we saw in the first wave of the virus.
Yes, and that is why it is important, even though it's hard economically, that we do keep the ban on alcohol sales in place. We've also seen research released in the past week that told us that when it comes to deaths, alcohol-related deaths, the partial restrictions, such as just a restriction on when you can buy alcohol, doesn't help much, that you really do need an entire ban on alcohol sales to open up hospital beds for COVID. And as you've mentioned, we are going to see a huge increase in the number of hospital admissions in the next 2-3 weeks, and we're really going to need those beds.
When we continue next year on In Focus, Dr. Aslam Dasoo, we ask the question, is it now beyond reasonable doubt that limiting social interaction breaks the chain of transmission? We'll get to that in a moment. Stay with us. Staying on, In Focus continues for you in a moment. Now, we've just heard from the president addressing the nation. He says in his address, we know that reducing the instances where people are in close proximity to one another contains the infection. Dr. Aslam Dasoo joining us on the panel tonight, Professor Francois, Dr. Mvuyisi, Mzukwa, as well as Malan. Dr. Aslam, do we know beyond reasonable doubt now that limiting social contact breaks the chain of transmission? I'll tell you what, because you're going to hear churches coming up and arguing this fact that there is no evidence to support that. You're going to hear the alcohol sector coming out saying there is no evidence to support it. However, the president mentioning particularly those areas, saying restaurants, taverns, church gatherings, as well as business meetings.
Good evening, Tabo. Look, I think this was known a long time ago, that we have to limit gatherings, because this is a very mechanical thing. You know, the virus spreads through aerosol transmission from person to person. And the more people you have in close proximity, the more the virus will spread. So that is quite elementary. And I think the maintenance of the restrictions, you know, adheres to that principle quite well, both for the religious and for the taverns and so on. You know, there's simply no argument to be made in favor of keeping those open, especially at a time of such intense transmission. So the research is in, certainly on the alcohol issue in terms of system pressure. Now, the fact that we've got a cliquey system may be true, but it's the system we have. If we had a much better resource system, then perhaps the restriction on alcohol could have been reduced, but that's not the case. The more important thing I think the president touched on was the issue of vaccination. When you don't vaccinate, three things happen. You have many people getting sick and dying. You have the development of variants, and we've seen the havoc they can cause. And you're required to continue restrictions, thereby damaging the economy, people losing their jobs, businesses closing. So what's not to like about vaccination? I'm very pleased. I think it's the first time I can say with some encouragement here, that I have been very encouraged by what I've heard, that we are going to have a more secure vaccine supply. It's been a set of hit and misses up until now. And I've been particularly excited about opening vaccination up to anyone over the age of 35. In fact, this should go to the age of 18. And when we hit vaccination at scale, over 350,000 people, which is very possible now, I think, with the public and private resources being put together, then we should vaccinate everyone as soon as we can. Because if we do that, we reduce the chance of any of those three, poor outcomes emerging. And I think this is pretty rational. So I would be, hard-pressed to look at the situation today that the president faces and say that, this is not enough. Yeah. It's a politically febrile moment in the country. We can see that. And it's a very difficult task facing the president and the government. But I'm hopeful that these problems that we are seeing don't impede the rollout of vaccines. We've got momentum now, and we must keep it.
Yeah. There's some of your colleagues who will argue that herd immunity is not a strategy. It is a biological fact, and it will eventually happen. That's how epidemics go eventually. But right now, we need some health interventions that will cause the least amount of human misery, death, and harm. I mean, does the president have that option?
Well, I think he's taken the right decisions to address exactly that. Look, the overarching human rights consideration here is to get us to a population level immunity. It's for the whole country. It's not about just vaccinating certain groups. This linear age de-escalation system hasn't worked. So that's now opened up, and I think we are now getting to the point where countries that have shown great success at this is something that we can now emulate if we have the supply as secure as we are seeing. I think one more thing is important to accept, that we face a pandemic where a number of unforeseen circumstances can emerge. We've seen that in our rollout. We've lost vaccine supply suddenly because we couldn't anticipate what was coming, and that might still continue. So we need more vaccines, we need more types of vaccines to be secured, and to roll it out as fast as possible. And I think if we focus on that, the country begins to open up, the economy opens up. We've seen that with certainly in the United States, they're expressing record economic growth right now since they've vaccinated so many of their people. And this is just a logical outcome of this process. We will also reduce the number of people dying, and of course that is a major human rights victory that we will attain. And lastly, the country will develop confidence. Confidence is very low, anxiety is high, and that ratio needs to change. So all in all, I think we're on the right track here.
Dr. Mvuyisi Mzukwa, one of the most difficult measures that was announced also in this conversation is, of course, the schools not opening until the 26th of July. It's very difficult to measure the effect of missed school for children. However, it seems this is important as part of the interventions to curb the infections.
Good evening, Thabo, and good evening to fellow panelists. I think we have noted, obviously, in Gauteng, when this third wave started, we noted how schools were affected in terms of cases being noted in the schools. But obviously, we know that it is affecting the future of children. But we have also lives to save, because those children, they go back to families with vulnerable populations there. So it is important that we obviously balance opening schools, but also protecting families, especially the elderly, especially because most of them are not vaccinated for obvious reasons, that there's some hesitancy, or else they can't have access, because of, transportation and all other challenges that are out there. But it is important that we respect what the president says, and obviously protect communities when we close down the schools, not for long as just the 26th of July. I think we can live with that.
4,200 deaths in the last 2 weeks. Something needs to be said about the patient recovery rate. Is there more that can be done as we are focusing, I suppose, on the vaccines, but those who are getting admitted, and we're seeing those hospital admissions rising, do health professionals have a better way of treating patients coming in now?
I think the most important thing was to strengthen the primary healthcare level. I think we're lacking there as the country. We need to prevent patients going to hospitals. This hospital-centric approach that we've embraced as the country for a long time is costing us at the moment. So I do think that at the moment now, the issue is that hospitals are full. But in the meantime, we need to have enough beds, but with personnel around those. We can't have beds that are not having allocated personnel. Otherwise, it looks like just like a hotel. So it is important that we address that, especially in Gauteng, where it looks like it's 100%, but also other provinces. The challenge is that we don't seem to have learned any lessons, from the previous waves. Because I do think that we know that when we're told the country is entering a wave, like third wave, whatever the case is, we need to know that in all provinces, They must be prepared. There must be tangible plans in place. You can't then start, running around when you are dealing with the actual epidemic. In fact, when you are actually having a wave in your province. So it is important that those plans are assessed, audited, even before, like for example, I'm worried about the Eastern Cape. You remember what happened in the Eastern Cape. I wonder what is happening now. I mean, really, we know that the Nelson Mandela Bay is affected. We do need to obviously make sure that other provinces are ready.
Mayor, what is happening in the Eastern Cape as far as the 7-day running average of infections?
Sorry, I couldn't hear you.
I'm saying, Mayor, what is happening in the Eastern Cape as far as the 7-day running average of infections?
I haven't checked that too recently, so I can't really comment on that. But what I can comment on is Professor Frente mentioned that we do need to, in order to keep people, to open up hospital beds and to prevent people from dying, we do need to try and reach older groups. And even though as we open it up for other age groups, it's very important that we continue to try and reach people of 60 and older. And the challenge for that is that once you have reached the old age homes, it's very hard to know where the people are. When you sort of go for teachers, you know where to find them at schools, but where do you find the rest of the older people? And the one place where we can find them is that many people, older people in the country, go to pension points at a certain time of the month. And I think it is encouraging to see that in the Eastern Cape, for instance, in rural Eastern Cape in Lusikisiki, there's now a project that has started where there are vaccination mobile vans parked at when people go for their pension payouts at the end of this month, and they will then be vaccinated. And the encouraging thing about that is not just for vaccination, but that the health department is now also looking at efforts to, for instance, reach those people with services that they can't regularly reach during COVID lockdowns, for instance, to test them for hypertension or for non-communicable diseases. So it can actually be used for something beyond vaccinations eventually. And I think it's really important that that specific effort is expanded across the country so that we can reach those people who really desperately need those vaccinations at the moment in a way that's faster than what we currently do.
Prof, enter a quick 30 seconds for us. CoronaVac from China now incorporated, Cuba as well finalizing their vaccine. Finally, is that good news?
So it's good news, as many vaccines as we can. The bad news is that we still don't have transparency from the Ministerial Advisory Committee on Vaccines. There's absolutely no communication, no explanation of increasingly bizarre decisions on their part. And we need to be demanding transparency there. We all invest in getting as many vaccines, high-quality vaccines out there as quickly as possible in as trustworthy a manner as possible. And part of that is good public health, which is transparency and communication about these decisions.
Let me thank you all for joining us tonight. Dr. Aslam, Dasoo, Professor Francois, Dr. Mvuyisi, Mzukwa, and